All right. Just so everybody knows, you'll be able to ask questions at the end. We will have a Q&A section. You can raise your hand during the meeting if needed. And I think we're about ready to start.
Send a message. How do they ask a question?
They'll raise their hand.
Okay.
We'll go over that part.
Sounds good.
Okay, so welcome. Here's a little bit, here's our agenda. We're going to be talking, give you a brief overview of who we are, ways to optimize your hormones, some facial sculpting with the VLR procedure that Dr. Kovak has, and then end on a Q&A. Yeah, so if you do have any questions, feel free to raise your hand using the reactions button. Should be right at the bottom of your screen. And then you can ask it right then and there, and then we'll be sure to answer them right at the end. So we are Kovak Cosmetic Center. Operation over 26 years, started by Dr. Kovak. Always been heavily involved in aesthetics, lasers, injectables. Always been a big trainer and big family practice here. You can see everybody's almost related, or at this point is adopted with us. So, we'll go ahead and start. Ready to go into it?
I'm ready. Good evening, everyone. Dr. Kovak. I'm going to talk to you a little bit about tonight. We'll talk about hormones, why they're good. And you can ask any questions you want. I've been doing them for over 20 years. And myself have been on for almost that amount of time too. I know it fairly well. I feel very comfortable with any questions you may have, easing any concerns you have, or anything you may want to know about it. We're also going to be talking about our VLR procedure. The VLR procedure stands for Vaso Lipo Renuvion. Helps with a variety of things. It's kind of replaced our laser lipo, but you can still think of it as lipo, just a much more refined and a better type of treatment to remove fat in key areas. We're going to focus on the neck. We can do other areas too. We'll mention it, but we're going to kind of focus a little bit on the jawline to how we can kind of shape the face a little bit. So first, we're going to talk about hormones. The first hormone, first of all, what are hormones? Okay, and they're essentially chemicals that we have inside the body. Their body makes them in what's called the endocrine system, and the endocrine system goes from head to toe. It's all over the body, and each particular area produces a certain hormone, a variety of different hormones. And these hormones, they travel in our bloodstream. That's how it works. It goes to particular cells and organs, whether it goes to your fat cells, your muscles, your skin, you name it. It goes to those variety of places, your brain, and it exerts certain effects on those cells. Okay, they bind to the cell. There's receptors in cells. And these hormones bind to those specific cells, and they elicit a response into the cell. And those responses can be a variety of things. Most commonly, it's building new proteins, but they also can shut off a cell or turn on a cell. And a particular cell will have multiple receptors on it, not just one. They have multiple receptors, which is why when we do hormone replacement, we don't just like to start off with just one at a time. We actually do a variety of hormones because your cells respond to a variety of different, has a variety of different receptors, so therefore respond to the variety of different hormones that we put into your body. But it can do a variety of things. It helps with body growth, energy production, cell repair, replication, helps with the cells when they've been injured, so that you don't have a strong oxidizing effect that injures a cell even more. So hormones can do a variety of things. The ones that we commonly know of and everyone's always aware of is estrogen for women, and testosterone for men, and thyroid for people who have thyroid problems. Well, that's how we think of it, but that isn't always the way it works. And surprisingly, hormones, even though we think of hormones as those are the things it does, estrogen to make you feminize you, testosterone to help your libido, and thyroid to help your energy. There's a variety of things that hormones can do. They work behind the scenes, and they do several things that can actually improve your overall body condition and help with your aging. That's how I like to say it. Okay, so the unfortunate thing is, as we age, our hormone levels decline. Now, God nature, whoever we like to consider helped design us, did not expect us to live a long time. I mean, at the very beginning, we, as humans coming out, we didn't have a long life longevity, right? We had a short one. And therefore, all our hormones were produced very early, and you're able to reproduce and have more children, keep the species going. However, as we become more civilized, sort of, and we continue on, as we get older, our cells start to age, and we stop producing the testosterone, estrogen, progesterone, all the hormones, essentially all decline. And it's just because as we're aging, our cells can't work as well, and they don't produce those hormones, and therefore the other cells that rely on those hormones, then they start to respond, and they start having the problems. And we all know those particular problems. Women, when they hit menopause, they start having night sweats or anxiety. Men, they start having decreased energy and weakness, and they start noticing other problems, joints and bones, and decreased libido. So all those things happen to all of us as we get a little bit older. Women have a pretty sudden drop off. It does kind of have, you can see on the left at the screen, shows there is a slight drop off, a kind of a curve, but it hits a certain point, and at that point is when the symptoms develop. And then there's a pretty steady state level, because now the hormone levels are not being produced by those particular endocrine glands, are being produced in other areas that have a very low level of production. And so even though there's still a small amount of hormones going around, it's just a low level, not enough to keep up with the cells that want a little bit more. For men, it's a gradual decrease. Testosterone decreases even in our 20s, slowly decreases, but it's always decently good until we start getting a little bit older. And as we get older, we start noticing the problems associated with low testosterone. So, when I told you that what we try to do with hormones, we try to optimize our hormones. Okay. So if you get a blood test, okay, and you get your blood level for your hormones, it will be very commonly normal. Okay. But what does normal mean? I hate the term normal. I don't like it at all, because it means that anything else is abnormal. And I just don't like that. I always tell my patients, I said, look, I'm 5'9", brown hair, gray hair, and brown eyes. And I don't fit into the population of Sweden, okay, where they're 6+ and blue eyes and blonde hair. So therefore, I'm not normal, which doesn't make any sense, right? So being not normal is not a bad term. I like being optimized or not optimized. And what happens is, as we age, our hormones are no longer optimized for our body. So we want to optimize them. And that's what we do when we are doing BHRT. And when you optimize your hormones, you're actually looking at levels and basing your symptoms that you're having on the level. And so what you want to do is you want to feel better. And so I look at your levels and I adjust them based on how you're feeling. And I don't try to get within what's called normal levels, because what's normal at 65 is not normal at 25. But I sure want those 25 levels, because it makes my cells function better. And so everything from weight gain to mood swings, all those things happen as we start getting a little bit older, decreased libido, and we want those things to sort of reverse. We want our bones to become stronger. We want our mind to be sharper, not to be cloudy. And you get that foggy feeling many times, and not quite as sharp anymore with numbers. All those things happen. We want energy. We want to be able to sleep well. So BHRT doesn't reverse aging. It doesn't make us 24 again, but it makes our cells function better, okay, for the best that they can. And that's what we try to do. We try to help with our aging process in essence. So we have just more of a better quality of life, okay, maintaining good health, or trying to push away any illnesses. So therefore, we can essentially fight the symptoms of aging. We can't, aging eventually catches us all, but we can definitely go down fighting pretty strongly when we are using hormones. So hormones, they work a variety of things. So we know that estrogen is a very strong sex hormone for women, right? It feminizes you. Women that put it on, they feel great on estrogen again. It does a variety of things too. It helps muscle tone, just like testosterone, makes the skin look better. So who doesn't want to have nice skin, right? The hair texture, if you get a little bit older, it starts to change a little bit, and you get a little more with estrogen. Your hair stays a little bit more full. The texture is a little bit better, and also estrogen is very important for sex drive. It does those things, but behind the scenes, estrogen does a variety of things, which is great. So it keeps your arteries open. Right? It helps break down plaque. That's very important, not only for your heart, which everyone jumps to right away. Oh, it makes my heart better. Sure, it does, but also helps your brain, right? You keep the plaque away from the little small arteries in your brain, and lo and behold, you have decreased incidence of having things like Alzheimer's. So estrogen is very important for that. We look at melatonin. That's another one out there. Well, melatonin helps me sleep. Sure, it does. It definitely helps you sleep, but it also does other things. There's melatonin. They've shown in studies that it can actually decrease risk for breast cancer. Helps with certain levels of blood levels. So it doesn't just do sleep. There are all these behind the things that help with it. Progesterone. We know that it's the yin to the yang for estrogen. It's the opposite. It kind of controls estrogen, which is very important. But it also does things behind the scenes. It helps maintain our bone strength. It helps also with decreasing certain types of cancer, like breast cancer and colon cancer. So there's a variety of things that hormones do, not just what we think. Testosterone, oh, it's great for libido. Yeah, it definitely is great for libido, but it maintains our muscle strength, maintains our bones, helps our skin. I said, and it also helps with arteries, just like estrogen does. It does arteries for men, which is why as men get older, they have more risk of having heart disease because their testosterone level keeps dropping, and it increases the risk for having some sort of heart problem. Thyroid, we know, helps us with metabolism. It helps with our cerebral function also. Things that work behind the scenes. It regulates your temperature, metabolism, all those things that are great for you. And DHA is another one that I absolutely love. People don't know what it does. It does a variety of things. They've shown that it actually decreases central fat, which is the fat that we get as we get a little bit older. That's part of it is because our estrogen and testosterone is dropping. Our DHA is also dropping. It helps with your brain, decreases risk for Alzheimer's and certain cancers. So these things work behind the scenes. So it's very important that when you're talking about bioidentical hormones, you're talking about how to improve your overall well-being. And that's how I like to describe it. And most people who go on hormones are very, very happy with using them because they see the benefits fairly quickly. You start getting the levels up to what are considered optimal, not necessarily what's considered normal, and it's better. I have many patients who tell me, "Oh, the doctor examined their blood tests and the blood tests were normal." Well, yeah, that's nice, but they weren't optimal. They still feel rotten. They still have low libido, still have low energy. They fall on the ice and they break a bone. We prefer not to have that. Okay, I'm not saying that it makes you into Superman. It doesn't do that, but it makes your cells the best they can. And when it's the best they can make you feel and act a little more healthy. We know that it impacts libido. It's a big time. Obviously, sexual health is a key important to your overall health. It obviously makes people feel better and just feel more like themselves, which is very, very important. And the hormones are a key role in our sexual drive. The two main hormones are estrogen and testosterone. These hormones can help with increased interest in sex, reduce the incidence of erectile dysfunction, and just overall improve sexual function and pleasure. Those are kind of important things, and that's what we follow because we can't follow behind the scenes. It'd be nice to be able to follow behind the scenes, see how well the estrogen and testosterone are doing for your plaque in your brain or in your heart. And those you can do a variety of different tests, but it's these small little arteries and capillaries that make a big difference. And those little capillaries, they help with your skin by keeping them open. They help with that. They keep the hair from thinning out. And so all behind the scenes stuff that we can't really assess as much. We can tell by seeing how well it affects your libido. If your libido improves, you know that the level is optimal now, and therefore it's affecting all the other cells in your body, not just the cells that help with sexual function, including the ones in your brain, your heart, your skin, your muscles, you name it. So the behind the scene things are as important, if not even more important, than just what is commonly known for these hormones. So what I do now with bioidentical hormone is I actually do a treatment through a platform called Mere Care. And we do a meeting virtually commonly. Sometimes I will do it in the office if people have a hard time with doing it on computer, but on computer is much more easy. And during the consultation, I will assess your needs and determine if bioidentical hormones are right for you. The way I'll do that is ask you a variety of questions. You'll fill out a pre-consult, some papers, and answer some questions that we have there for you. And then I'll talk with you about each of those and see if maybe you are suffering from symptoms of bioidentical hormone or hormone loss. First thing I'll do is I'll get a blood test, and I'll check a variety of things. I won't just check your hormone levels, which are very important, but also check your other blood tests, your liver functions, and your cholesterol, and your white count, your overall chemistries. I'll check all that, and then I will we'll have another appointment. We'll follow up, go over all the test results, and discuss those things, and where the lows are, where the highs are, any problems associated with it. At that point, then we'll talk about the treatment, and each treatment is predicated upon the belief that everyone is an individual. And I have to treat you individually based on what your symptoms are. Some people I'll put on this drug, some people I'll put on that drug, some people I'll split the drug twice a day. Some people will be only at night, some people during the day. Everyone is a little bit different. And it's very important that you treat it differently. You don't just go online and you get something ordered. A lot of times people have symptoms and the doctor will just order something, never check the blood test, never find out how overall the improvement is doing. And they say, oh, well, we check you once a year and your blood test is normal. That's not enough. I will initially follow you fairly frequently until we get to what's called our optimal levels. So it's very important. We got to just make sure that you are improving with energy, sexual function, a variety of those things that I can assess and you can assess. And then I know that all the things that are behind the scenes are actually doing their job, because those are the important things that help our cells maintain their youthfulness and keep us healthy longer. So our next subject, and I know it was a brief one on hormones, but I hope that explains it kind of succinctly. And if you have any questions, definitely you can answer at the end here. I want to talk about facial contouring. Okay, so the facial contouring is kind of a new concept that's coming out. How do we contour the face? Well, we know as we get older, and even when we're young, sometimes we have areas that have excess fat or too little fat. Many times with facial contouring, we'll put fillers in to help where there's loss of fat, but sometimes there's fat where we don't want it or excess fat. And that's where we get involved and try to do things that are minimally invasive. And one way of minimally invasive doing things is what we call our BLR procedure, which consists of a laser, liposuction, and Renuvion, 3 different devices that we do. And our goal is to work on jawline definition. That's probably the best way to do it. And so when we try to improve the jawline, we go from that, as we get a little bit older, we kind of have a little bit of a bulge on there. Or even when we're young, sometimes we have too much fullness in the face, and we want to get the jawline a little more visible, because it's kind of the more prettier look, I guess is probably the way to say it, that people want to have that jawline defined. And so what we do is we go through the treatment where we actually numb the area, and then we go through and break up the fat with this device called the Vaser. It's a very, very precise way of breaking up fat cells. The reason why is because it uses an ultrasound, which vibrates very quickly and shakes the fat cells apart so that they break down and they can then be removed through liposuction. The Vaser is nice in that there's not excess heat created. And when you're treating the neck and the jawline, it's a small area. It's not a big area. So the heat can't travel very far. You just sort of localize. And if you have too much heat, which occurs when you're doing laser, you sometimes can cause injury. The Vaser doesn't do that. You don't have this unwanted heat. There's a vibration that makes it a little bit warm, but it doesn't create heat that's so high that typically a laser can do, that you can cause a type of injury. And then we do the liposuction. The liposuction pulls out the melted fat much differently than the traditional liposuction, which cuts out the fat. So we get a much more smooth look. Our final approach is that we actually use a Renuvion that combines both radiofrequency and helium plasma to heat the tissue. The old method was to actually either leave it alone and hope that you tighten up on your own. As we get a little bit older, we don't tighten up. When you're younger, we can. When we're older, we don't. Or to use a laser. And the laser, again, will create excess heat. And there's always a risk of having that. With a plasma torch, it actually causes very, very gentle heating of the tissue in specific areas, so we don't get that issue. And we can actually tighten that tissue much more so than we can with even the laser. Look at the face. There are, we have outside fat and even inside fat. Commonly, we have the buccal fat. Okay, and people say, well, I might have buccal fat removal. Well, if you look at where the buccal fat is, it's right there, kind of the space of open your mouth that's between your teeth. And that's the buccal fat. And a lot of times people want that removed, but when you look at them, it's really all the fat that's located along the whole jawline. You have the inferior jowl fat, you have submandibular jowl fat, you have the even part of the superior jowl fat. That whole area there needs to be many times contoured because there's excess mouth, especially if you get a little older, it seems to fall south, and some people just have a larger mouth there. So when you're doing a buccal fat removal, you actually are just removing that little inside fat, and that's doing a surgical procedure from the inside of the mouth, which is fairly simple. Some good bruising, they often cause some good bruising, but it doesn't catch the jawline at all. And when you're doing jawline, the VLR approach, you're actually catching those that fat along that jawline, even in the same area where the buccal fat is, so that you decrease the area by the buccal fat. So you can get a little more precise definition of that jaw. You can see this in the video. You can see how the outside fat, that's that below the buccal fat area, is bulging out. She has kind of an S curve there, and you look after a procedure, you have a nice straight line, and that's actually 2 years later. It's still a nice straight, nice tight angle that you want to have to face for the little bulging that happens when you get a little bit older. Young people, they thought, well, let's do the buccal fat. Well, actually, the buccal fat wasn't an issue. It was all along the whole jawline. We had to kind of tighten it and give a little more of a V shape to her face. And this is, again, 2 years later. So it lasts for quite a long time. It's a minimally invasive procedure that can remove that fat and tighten up the tissue. So,
Okay.
do you have any questions, right?
Do we have any questions? We do have a few questions, actually.
Okay.
So the first one we have was, what is the downtime with VLR?
Okay. Well, so about downtime, it's a minimally invasive procedure. We have to go on the inside. You'll have some bruising. I tell people they have to wear a wrap, kind of something that holds the face, the tissue up against the jawline, so it keeps it in place. You have to wear the wrap continuously for 4 days. So if we do it on a Wednesday, to wear it through Thursday, Friday, Saturday, Sunday. On Monday, they can take it off. If they have to go to work, ideally, I want them to keep it on as much as they can for the following 3 weeks. So that means at night you'll put it on. If you're not at work, you'll put it on. If you're running to the store, you can take it off and then put it back on again.
Okay, our next question here is, what age should I start hormones?
That's a good question. Okay, so obviously people start thinking about hormones when they hit menopause. Men start feeling it when they have some libido challenges. But it all depends on your symptoms that you're having. Women can have it in their 40s. Men can have it in their 40s because they're not noticing the same way. They were not feeling the same way they were when they were younger. And it's not just the hormone change or the libido change that you notice. There's a lot of things you can have. It's just general weakness. You don't have the energy. You don't have the drive. You have the cloudiness. All those things kind of tell you that, hey, something's not right. I don't feel myself. So you could actually start. Many times people, I have them start in the 40s and up. And there are some that will even start even a little bit earlier. And they usually have some sort of a condition or something that causes their hormones to drop. And those have to be tested for.
Okay. And then are there any side effects with BHRT?
So yeah, that's a big question. There's side effects of BHRT. Well, the side effects with doing hormones can be a variety of things. You can have with thyroid, if too much thyroid is, you get some palpitations. With testosterone, too much testosterone, you get acne or even a little bit excess hair that grows. With estrogen, you can have some breast tenderness. With progesterone, you can have a little bloating. All those things can potentially happen. However, the way that I do the program is that I watch you very carefully. We don't just suddenly give you high doses, which many times you get, a prescription for something and wham, you're right at this high level. I like doing it very, very slowly. You gradually increase so your body gets used to those hormones again. And I watch you every 60 days. Initially, you'll get a lot of blood tests. Eventually, I spread it out. But initially, I'm watching. So it's a very carefully determined approach that I do in order to get your levels up, your optimal levels, without giving you the side effects or the symptoms. So we can pretty much avoid those symptoms.
Okay, we got time for one more question. And actually, a patient sent this over email because they weren't able to attend. But why are we doing VLR over laser lipo anymore?
Okay, so yeah, so they missed it. you guys probably already know the answer. So with laser lipo, which is what we did, again, everything changes, right? Every so many years of new improvements. So laser lipo still is fairly popular. However, the laser part creates heat that stays within the tissue. And even though you're firing on the back end of the jawline versus the front end of the jawline, the heat still is felt here. With VLR, we don't have to worry about the excess heat, whether it's melting the fat or whether it's heating up the tissue. And that's the most important thing. So we want to create the best effect without having the excess heat that potentially cause problems.
Okay. Well, I think we are pretty much out. Oh, we have one more question. How are bioidentical hormones different than other available hormone therapies? And this, we do have to make this our last question.
Okay, yeah. So actually, there are a lot of difference between other available hormones. So you think about hormones, and most hormones that are out there are synthetically made. They're very, very strong, and that's how they're meant to be. They work very well. And that's why you get a prescription for one particular pill, and you go on for that. But I don't like the synthetic hormones. They're not what is natural to our body. And what's natural to our body allows our bodies to break them down and use them properly. What's unnatural or synthetic, the body doesn't break it down. So you take a drug like a synthetic estrogen, it will break down into its components, which then, first of all, will take several weeks to break down versus a day or two, which is normal for estradiol. But then its metabolites are actually even stronger than the initial one. So you have this constant buildup of estrogen. No wonder why there's problems associated with using the synthetic ones. And that's whether it's synthetic testosterone, which can affect your liver, or synthetic progesterone, which actually has shown to have an increased chance for having breast cancer. So the synthetic ones I don't like. The natural ones are what is in our body, and that's ones that we're going to use with BHRT, which is why it's called bioidentical, which means it's identical to what's in our biology.
Okay. I think we're out of time. Okay. Thank you, everybody, for attending.
Thank you.
And if you have any more questions, please feel free to email us at patientservices@covaccc.com.
Everyone have a good night.
Thank you.
Bye-bye. That's it.
Very good.
Was it good?